So a lot of people may have never heard of an avulsion fracture, and the fact that it says fracture in the name of the pathology can be somewhat scary. Fortunately, there are a lot of things that we can do conservatively, which means without surgery, without drugs, injections, needles, things like that, that can significantly help this injury. So what is an avulsion fracture? An avulsion fracture is actually one of the most common deceleration type injuries in sports. What that means is maybe a player's jumped in the air to rebound a basketball and they're landing, and while they're landing, their muscles are triangulating the force of their body and the force of gravity and trying to figure out how hard to pull to slow them down. Or maybe they've thrown a baseball and they're slowing down their arm. This is when avulsion fractures happen. And essentially what happens is the muscle pulls so hard on the bone that it pulls off the bone a little bit. Now, it's not a true fracture in a sense that there's not a break there, like a complete line. Instead, it pulls and deforms the bone, so you end up with a big soft spot with a lot of swelling. And when that heals, you'll ultimately have a little bulge in your bone there where the muscle attaches. But fortunately, that's okay. That's not gonna diminish your lifespan, your ability to play sports, your ability to do anything. We just have to heal that up, let that calcify and get strong, and then get you back on the court. At our office, we have two specific modalities that have been shown through science to accelerate the healing of avulsion fracture so that your athlete, your student athlete, or yourself can get back out there and play faster and harder and not worry about further injuring that break. So the first one is low-level laser therapy. So it's a specific frequency of light that's been concentrated, and when the light goes into the tissue, it basically brings accelerated healing into the cells. The second thing that we use is a pulsed ultrasound. This has also been shown to accelerate bone fractures and avulsion fractures dramatically. I mean, sometimes up to half your normal wait time to get back on the playing field by helping the bone to remodel, which means put in new calcium, build strong cells, and reinforce the area where that fracture happened. So if this is something you've suffered with, feel free to step on into our office, shoot us an email, call us, or find your local therapist and see if they can't help you with these two modalities to get you back out on the court playing.